Hi everyone, welcome back. I'm so glad you're here today. If you're new to the channel, a big warm welcome to you. Make sure to hit that subscribe button so you don't miss out on all the valuable content we have coming up. Magnesium is an essential mineral that has many important roles that are vital for our bodies to function properly. It's involved in over 300 enzymatic reactions, which include processes like energy production, DNA synthesis, and muscle function. A deficiency in magnesium can lead to a variety of health issues. Did you know that magnesium deficiency is a common condition worldwide? This is why in this video we will reveal to you 10 weird signs of magnesium deficiency. Now, without any further ado, let's get to it. Number 1. Muscle cramps and spasms. Magnesium has an important role in controlling muscle contraction. When a muscle contracts, calcium ions flood into the muscle cells which stimulate contraction. After that, magnesium counterbalances this contraction by pumping calcium out of the cells, allowing the muscle to relax. When magnesium is low, calcium can dominate, leading to prolonged and painful muscle contractions. Incorporating foods rich in magnesium, such as leafy greens, nuts, seeds, whole grains, and fish, can help prevent cramps. It's important to consult a healthcare provider. Persistent cramps may indicate a more serious underlying issue, such as a significant magnesium deficiency or another health condition that requires attention. Number 2. Mental disorders. A mental disorder, also known as a mental illness or psychiatric disorder, is a condition that affects a person's thinking, feeling, mood, behavior, or overall mental functioning. Mental disorders can manifest as a result of chemical imbalances in your brain. These chemicals are known as neurotransmitters. For these neurotransmitters to be produced, magnesium needs to be available in adequate levels. Examples of these neurotransmitters include dopamine and serotonin. Dopamine is involved in reward and pleasure pathways, as well as body movements and mood regulation. Whereas serotonin is often referred to as the feel-good neurotransmitter because it regulates mood, anxiety, and happiness. Without magnesium, the production of these neurotransmitters will decrease, leading to mood disorders such as depression and anxiety. Magnesium helps regulate the body's stress response by modulating the activity of the hypothalamic pituitary adrenal HPA axis, which controls the release of stress hormones like cortisol. Low magnesium levels can lead to an overactive HPA axis, increasing feelings of anxiety. If someone is experiencing symptoms of a mental disorder, it's important to seek help from a healthcare professional. Early intervention can improve outcomes. Number 3. High blood pressure. If you have been suffering from chronic high blood pressure, have you ever considered that you may have low levels of magnesium? Magnesium deficiency can cause high blood pressure. Magnesium helps to relax and dilate blood vessels by acting as a natural calcium channel blocker. This process reduces resistance in the blood vessels, allowing blood to flow more easily and lowering blood pressure. Magnesium helps regulate the balance of sodium and potassium in the body, both of which are critical for maintaining normal blood pressure. A deficiency in magnesium can lead to an imbalance, particularly an increase in sodium retention, which can elevate blood pressure. High blood pressure is often referred to as the silent killer because it can exist without noticeable symptoms, so proactive management is key to preventing serious health complications. It's important to consult with a healthcare professional. Number 4. Fatigue and weakness. Fatigue and weakness are common symptoms of magnesium deficiency, affecting both physical and mental energy levels. Magnesium is essential for the synthesis of adenosine triphosphate ATP, the primary molecule that stores and transfers energy in cells. ATP must bind with magnesium to become biologically active. Without sufficient magnesium, ATP production is compromised, leading to reduced energy availability in the body. Magnesium deficiency can lead to a 30% reduction in ATP production in muscle cells. Magnesium supports the function of mitochondria, the powerhouses of cells that produce energy. A deficiency can impair mitochondrial activity, further contributing to fatigue. People with low magnesium levels often experience reduced endurance and stamina, making physical activity more challenging and leading to quicker exhaustion. If you experience persistent fatigue and weakness, especially if these symptoms are accompanied by other signs of magnesium deficiency, it's important to consult a healthcare provider. Number 5. Asthma. Asthma is difficulty breathing due to tightening of the airways. Being deficient in magnesium can exacerbate the symptoms of asthma. Magnesium acts as a natural bronchodilator, meaning it helps relax and open up the airways bronchi in the lungs. This is crucial for people with asthma, as their airways can become constricted during an asthma attack, making it difficult to breathe. Symptoms manifest as difficulty breathing, rapid rate of breathing, and wheezing sounds from the lungs. This is further proved by an analytic study which revealed that airflow in asthmatic patients improves by 8 to 12% when given magnesium supplements. If you have asthma and suspect that a magnesium deficiency might be contributing to your symptoms, it's important to consult with a healthcare provider. Number 6. Personality changes. Magnesium deficiency can lead to noticeable personality changes due to its role in regulating brain function and mood. Magnesium is involved in regulating the hypothalamic pituitary adrenal axis through which the body's response to stress is controlled. Low levels of magnesium correlate with high levels of the stress hormone cortisol. Magnesium helps regulate neurotransmitters and stabilize mood. Without adequate magnesium, individuals may become more easily agitated or frustrated. This is why people may experience frequent mood swings, increased sensitivity to stress, and a shorter temper. A study in the Journal of the American Board of Family Medicine found that magnesium supplementation improved mood in 42% of elderly patients with magnesium deficiency. If personality changes are significant or persist, seeking professional advice is crucial. A healthcare provider can assess magnesium levels and recommend appropriate treatment or further evaluation. Number 7. Sleep issues. In the brain, magnesium facilitates the binding of gamma-aminobutyric acid to its receptor. When the binding of gamma-aminobutyric acid to its specific receptor happens, it promotes relaxation and reduces the electrical impulses fired along your nerves. In other words, it calms your brain, which is vital to induce sleep. Magnesium is also involved in the regulation of the sleep-wake cycle. A deficiency can disrupt this cycle, leading to fragmented sleep. Without enough magnesium, you might wake up frequently during the night, have shallow sleep, or experience restlessness. Magnesium helps regulate melatonin, the hormone that controls your sleep-wake cycle. Without sufficient magnesium, melatonin production can be disrupted, leading to insomnia. So, if sleep is something you've been struggling with lately, check your magnesium blood levels and take magnesium supplements if needed. Studies have reported significant improvements in sleep quality after following up individuals who were given magnesium supplements. Some trials showed up to a 50% improvement in sleep parameters for those individuals. Number 8. Numbness and tingling. Magnesium is crucial for the proper functioning of the nervous system. It helps regulate the transmission of electrical signals between the brain and the rest of the body. When magnesium levels are low, these signals can become disrupted, leading to sensations of numbness or tingling. Not only that, but magnesium also helps regulate the release of neurotransmitters such as acetylcholine. This neurotransmitter is responsible for muscle contraction and movement by communicating the impulses from the nerves to the muscles. Without sufficient magnesium, there's impaired nerve-muscle communication. This manifests as a sensation of numbness and tingling in the muscles. Consuming more magnesium-rich foods such as spinach, almonds, avocados, and whole grains can help restore normal nerve function and reduce symptoms. In cases of significant deficiency, supplements may be recommended. However, it's essential to follow a healthcare provider's advice on the appropriate dosage. Number 9. Migraines. Unfortunately, suffering from migraines is a dreaded symptom of low magnesium levels. Unlike other types of headaches, migraines are described as a throbbing and pulsating head pain on one side of your head. Magnesium helps relax blood vessels, preventing the constriction and subsequent dilation that is often associated with the onset of migraines. This vasodilatory effect can reduce the frequency and severity of migraine attacks. Magnesium acts as an N-methyl-D aspartate receptor antagonist. N-methyl-D aspartate is a neurotransmitter responsible for pain transmission. By acting as a receptor antagonist, magnesium decreases the effect of this neurotransmitters. However, magnesium deficiency leads to hyperactivation of N-methyl-D aspartate receptors, causing an increase in the activity of nerve cells in the brain and pain transmission. Through this mechanism, magnesium deficiency contributes to the pain associated with migraine headaches. If you experience frequent or severe migraines, it's important to seek medical advice. Your healthcare provider may recommend testing your magnesium levels and suggest dietary changes. Number 10. Osteoporosis. Osteoporosis is a disease where your bones become porous due to low bone mass and density. As a result, your bones become weaker, with a higher probability of fracture. Magnesium is essential for bone formation as it helps convert vitamin D into its active form, which is necessary for calcium absorption. About 60% of the body's magnesium is stored in the bones, where it contributes to their structure and strength. Magnesium deficiency can lead to a decrease in bone density, making bones more fragile and prone to fractures. This occurs because magnesium is crucial for the mineralization process in bones. Magnesium affects the size and strength of hydroxyapatite crystals in bone. Deficiency can result in larger, less dense crystals, contributing to bone weakness. Hydroxyapatite is a mineral compound that makes bones hard and strong. Research in animal models has shown that magnesium deficiency leads to bone loss. If you have risk factors for osteoporosis, it's important to consult with a healthcare provider. They can perform tests to evaluate bone density and magnesium levels and recommend appropriate treatments to strengthen bones and prevent fractures. As unexpected as these signs may be, they can help you identify magnesium deficiency. Thank you for watching my video and for being a part of this journey. Your support is incredibly meaningful to me, and I'm so thankful to have such a wonderful audience.